Welcome to the world of human science. Today we will explore one of the most relevant topics for human health: diabetes. This chronic disease profoundly affects the lives of millions of people worldwide, requiring careful management and a thorough understanding to mitigate its negative health effects. Diabetes is a complex condition stemming from an alteration in glucose metabolism, the primary energy fuel of the human body. Normally, our body regulates blood sugar levels through the action of insulin, a hormone produced by the pancreas. However, in diabetes, this regulation system is compromised. Diabetes can result from two main mechanisms. In type 1 diabetes, the immune system mistakenly attacks the pancreas's beta cells, responsible for insulin production. This type of diabetes is often diagnosed in youth and requires lifelong insulin administration. In type 2 diabetes, the body becomes resistant to insulin produced by the pancreas, or the pancreas fails to produce enough insulin to meet the body's needs. This type of diabetes is closely linked to risk factors such as obesity, sedentary lifestyle, poor diet, and genetic predisposition. Type 1 diabetes is less common than type 2, accounting for about 10% of all diabetes cases worldwide. It is estimated that more than 1 million people in the United States live with type 1 diabetes, with approximately 40,000 new cases diagnosed each year. This type of diabetes requires constant management and regular monitoring of blood glucose levels to avoid acute and chronic complications. On the other hand, type 2 diabetes is much more widespread, representing approximately 90% of diabetes cases. It is particularly prevalent among middle-aged and elderly adults, but has shown a significant increase among young people and adolescents in recent years, paralleling the global obesity epidemic. This type of diabetes is closely linked to modern lifestyle factors characterized by a high-calorie diet, poor in nutrients, decreased physical activity, and a genetic predisposition that can influence individual susceptibility to the disease. The specific causes of type 1 diabetes are not yet fully understood, but it is believed that a combination of genetic and environmental factors plays a crucial role. Heredity seems to play a significant role, with a higher risk of developing the disease if a close relative is affected by type 1 diabetes. Regarding type 2 diabetes, risk factors are well documented. Obesity, particularly excess abdominal fat, is one of the main modifiable risk factors. Excess abdominal fat affects insulin resistance and increases the risk of developing type 2 diabetes. Other risk factors include physical inactivity, an unhealthy diet rich in high-calorie foods and poor in fruits, vegetables, and fiber, an aging population, and a genetic predisposition that can influence individual susceptibility to the disease. Early recognition of diabetes symptoms is crucial for timely diagnosis and immediate initiation of treatment. Common symptoms of diabetes include excessive thirst, polydipsia. Due to the high concentration of sugar in the blood, the body tries to eliminate glucose through urine, causing dehydration and persistent thirst. Frequent urination, polyuria. Increased urine production is a direct consequence of the body's attempt to eliminate excess glucose through the kidneys. Intense hunger, polyphagia. Despite increased food intake, the body fails to use glucose as an energy source due to the absence or ineffectiveness of insulin. Unexplained weight loss. Despite increased appetite, many people with type 1 diabetes experience significant weight loss due to the burning of fats and proteins to obtain energy. Chronic fatigue and tiredness. Due to the inability of cells to use glucose as an energy source, many diabetes patients experience constant fatigue and weakness. Blurred vision. High blood sugar levels can temporarily affect the shape of the lens inside the eye, causing blurred vision. Slow healing of wounds. Elevated blood sugar levels can adversely affect the body's ability to properly heal cuts and wounds. Now that we have thoroughly examined the definition, types, causes, and symptoms of diabetes, we are preparing to explore how physical exercise can play a crucial role in improving the quality of life for people affected by this disease. We will explore how an active lifestyle, including regular exercise and targeted physical activity, can contribute to the effective management of diabetes and the prevention of associated complications. Stay tuned as we delve into this important topic on human science. Physical exercise represents a fundamental pillar in the effective management of diabetes, contributing to the control of blood sugar levels and the prevention of long-term complications. Let's explore how physical activity affects the body and the recommended training strategies for people with diabetes. Regular physical activity improves insulin sensitivity, facilitating glucose uptake by muscle cells and reducing blood sugar levels in type 2 diabetes. Furthermore, it promotes lipid metabolism, reducing triglycerides and increasing HDL cholesterol, thus improving lipid profiles and reducing cardiovascular risk. Aerobic exercise, such as walking, running, or swimming, increases glucose consumption during activity and enhances pulmonary and cardiac capacity. Resistance exercises like weightlifting or resistance training help increase muscle mass and improve long-term glucose regulation. The exercise regimen for diabetes should include aerobic and resistance exercises, integrated with stretching and balance exercises to improve flexibility and reduce the risk of falls. It is recommended to perform at least 150 minutes of moderate-intensity aerobic activity per week, spread over 3-5 days. Resistance exercises should be performed 2-3 times a week, involving all major muscle groups. Exercise frequency and intensity should be adjusted according to physical condition and blood glucose levels. Regular monitoring of blood sugar levels before, during, and after exercise is essential to prevent hypoglycemia. It is advisable to start with short-duration and low-intensity exercise sessions, gradually increasing based on physical capacity and stabilization of blood glucose levels. During exercise, it is important to be aware of hypoglycemia warning signs and have readily absorbable carbohydrate sources on hand to promptly treat hypoglycemia if necessary. Coordinating the exercise regimen with the diabetes management plan, adjusting insulin doses or diet as needed to prevent extreme fluctuations in blood sugar levels is recommended. In conclusion, regular physical exercise is a valuable resource for improving the health and well-being of people with diabetes. In addition to enhancing blood glucose control, it provides significant benefits for cardiovascular, metabolic, and overall health. With a well-structured training regimen that includes aerobic, resistance, stretching, and balance exercises, individuals with diabetes can effectively manage the disease and improve their overall quality of life.